And welcome. Today's video is a Hydrus revision. This was a Hydrus put in about 6 months ago, was working very well, and at the 6-month visit the pressure was noted elevated. I did a gonio and saw this. The tube has iris entrapped in it. It came up around the top and into that little notch there. I don't know what the formal name is for that. So just like with iStent G1 and iStent Inject, although I've never seen iris attack one, with the G1 and with the Hydrus, this is my preferred technique. I go in with microforceps and tease out the iris tissue. You can see me doing that. You try to reverse the direction and pull it out. It usually comes out without any trouble at all. And I try to sweep around a little bit. And this is just done under viscoelastic through a paracentesis. Take your time here. It generally comes right out. I really haven't had much challenge. Why it goes in the first place is something I'll never quite understand when the majority don't, but every now and then they do. So here I am just reinflating with a little bit more viscoelastic, get a better view to make sure that everything's out. Looks pretty good. Then I wanted to reposition this one a little bit, pull it out of the canal so it sticks a little bit more into the anterior chamber. I know that seems a little counterintuitive, but I think it was too peripheral when it went in. So just going to give it a little tug, nice and gentle, and you can see it does reverse and come out. And if you ever actually had to remove one, that would be a way to do it without just tearing it through. And then I take a 27 gauge needle and I'm just running that groove in the collar portion here because it's not well visualized on the video, but live I could see there were some fibers in there. So I just wanted to clear those out, make sure this thing was completely free. So that's what you're seeing me do here, just kind of run that tip in the groove out towards that ostium. So now that I have my tube free, the iris is clear, I don't stop here. I'm going to take the vitrector and chunk out a nice little iridectomy right at the tip there. And the reason is the forces that were there to cause it to block in the first place are still there. And since I'm here anyway, it's really not that much more to put in a little iridectomy to free the tip completely and prevent any future entrapment. You'll see my settings here. I have it on one cut with aspiration first. And you can just, each time I put the pedal down, it'll cut only once. And that gives me really great control. So I can chunk out that little hole right in front of the ostium. So here I'm with a little viscoelastic, opening it up, and you can see there's a little lip there that's right by the tip. So I go in one more time, and we're going to take that out just to make sure we got nothing coming back into that tip. I find this procedure works extremely well, and typically the pressure goes right back down to where it was before it got entrapped like that. All right, so one final last look, and then I go in through a second pair with a bimanual IA to remove all the viscoelastic. And there we have it. That is a Hydrus revision with iridectomy. And thank you so much for watching.